took charge of the condition, we learned from the Ebola experience, took advantage of that and started building thinking, collaboration, policies around issues like this. People started discussing One Health, and I'm so glad that the members of the Ministry of Agriculture, right, who, as far as I'm concerned, take about 30% of the response from here. I've been here for the past 3 days. My colleague is going to introduce them formally. So yesterday we did vaccine strategy. We talked about fundraising, funding for delivering a vaccine strategy. When one of our speakers from Jensen's did talk yesterday, she started with saying, look, vaccine strategy, they got initial seed funding, partly by government and later by industry that organized and saw the prospects and the possibility of growth in that area. We talked about platforms for actually carrying out the tests and the development of these vaccines. We talked about things like accelerated approvals, because the whole idea of a vaccine strategy will also to reduce the time of experimentation and testing, reduce the time of delivery, and reduce the cost as well. We talked about, access, universal access of the vaccines. There are things that can hinder, there are things that can aid universal access to vaccines. That's in the strategy. So it's all about a service delivery approach to science, research, connecting it with results, and delivering, most especially delivering to the people. There was a lot said about political will and the role of government, and for me, this was the highlight, and it probably covers all the categories and strata of discussions we might have been having. The second session did talk about developing policies that will enable, and a policy, we were corrected by the gentleman that gave that paper, that policies are not what you write. Policies are actually what you carry out and do. So, and he gave us a pathway to, just put the policy together. You make sure that the policy is dynamic. It must have some kind of stakeholder engagement. It must have some institutional framework behind it. It must have political will. This is where political will comes up again. And most especially, policies or initiatives have to have monitoring and evaluation frameworks. They say whatever you do not measure, you cannot manage. Whatever you cannot manage, you cannot direct. Whatever you cannot direct, it is very difficult for you to even achieve. Therefore, monitoring and evaluation, certain and periodic monitoring and evaluation will give you trajectory, will give you momentum in any policy or in any initiative. We also discussed the issue under the One Health issue, and this is where we saw what One Health actually is. The fact that the health of the environment, the health of animals, and the health of human beings are so integrated that, to start considering one without considering the other is, probably, it's not just, it will amount to nothing. And this is why, for example, when we have our people from the Ministry of Agriculture here today, we know that that's the full reflection of it. The environment, and how that affects us. Yesterday we also had the Africa-wide perspective of, in overcoming antimicrobial resistance. The African Union has done quite a bit of stuff, and we had a presentation on that yesterday. We also ended up with discussions for that session on the ethics of genomic research, and the paper actually talked about what were the obligations of researchers, both researchers and those who will take it, whatever the products of the research downstream. we talked particularly about engaging the communities, engaging, not shaving people's head behind their backs, engaging the communities, engaging other stakeholders, the collaboration and the cooperation between different actors were resounded. Now I'm going to call on my colleague, Mojibade, the beautiful Mojibade, and I would have thought a round of applause for her, even if you're not giving me the round of applause, is indeed. As she's going to talk about the last session briefly before we go on to introduce Professor Akio Shimon, who is going to deliver the first paper. Mojibade, good morning. Thank you. Thank you.
Good morning. Thank you so much, Dr. Shino. He won an award yesterday, by the way. He was specially recognized for his contributions to GET Consortium and to the entire conference so far. All right, good morning, ladies and gentlemen, and welcome to day 3 of the Biosecurity Conference. He didn't ask me what my thoughts were when he was going around, but I'll share. It's been thought-provoking so far. It's my first time at the conference. I am not a doctor, I am not a health practitioner, but I have learned so much, and it has been nothing but enlightening. And I think that all our speakers are phenomenal, they are eminent. I'm like, who are these people? I've had such a fantastic time. A round of applause, a round of applause. And I'm certain that today it only gets better. Yesterday we had conversations around, towards the end, so he's handled the first 2 sessions. We spoke about the role of data and sociocultural insights in outbreak response. Then we went on to understand the important role of IPC training during a pandemic and the role of CSO in the fight against COVID-19 in Lagos State. So the civil service organization, there was a presentation and they highlighted everything they did during the COVID-19 pandemic. The pandemic was hell enough for most people, but their contribution made it easier for a lot of Lagosians, and I think we should applaud them once again. Their presentation was very, very enlightening. I saw everything they did, and we just want to applaud them and say that we recognize what you're doing, and we just want to say thank you so much. We also spoke on the importance of IPC training. A lot of people think that IPC training is a post-outbreak response, but no, it should be a lifestyle. That is infection prevention and control should be a lifestyle and not something that just comes up when there's a pandemic. So it should be something that we inculcate into our daily living. And finally, one thing that is very, very critical is communication during an outbreak. Communication is as important as the outbreak itself, because how you communicate to everyone really matters. There are different cadres in the society, there are different people who need to understand. You would think that even the educated people understand fully, but they don't. They need to understand the impact, they need to understand the implications of certain things. So that was really very, very insightful. And one key thing I took out from that conversation around communicating during a pandemic is that a relatable approach to communicating outbreaks like that of COVID-19 always makes a difference. Thank you very much. And Dr. Mr.